This conference will now be recorded.
Exam test.
This conference will now be recorded.
Hello. Hello. Today we will discuss about the drug dependence. So many people will take the drugs, as you know. So it is a dependence they have to take, otherwise they are cry for that drug. So what are the terminologies for drug dependence? Substance dependence, substance abuse, substance intoxication, physical dependence, psychological dependence, drug habituation, and addiction. So due to the addiction, they will take repeatedly the drugs, and the substance dependence. So maladaptive pattern of substance use leading to a cluster of behavioral, cognitive, and physiological phenomena that developed after repeated intake. Because of the repeated intake, because of the addiction, there are changes in their behavior, cognitive, and physiological phenomena. So characteristic features of the drug dependence. So when once the dependence developed in the persons, there is a strong desire to take the drug, and a difficulty in controlling its use. So no control is tries to take frequently, and a persistent use despite harmful consequences. Though there will be harmful consequences, it is very difficult to control once he is addicted and a strong desire to take the drug. So high priority given to drug use than other activities. So you will not do work, and so there will not be any interest in other activities. So high priority will be given to the drug use. So exception, certain non-dependence producing substances are abused by way of prolonged, unnecessary, or excessive intake, which cannot by term substance dependence, analgesics, laxatives, antidepressants, antacids, vitamins. Then coming to the substance abuse, maladaptive pattern of substance use manifested by recurrent and significant, so repeated take of the drug. There are so many adverse effects. Recurrent and significant adverse consequences are related to repeat intake of the substance. These problems must occur recurrently during the same 12-month period, includes harmful consequences on repeated use, does not include tolerance, withdrawal, or a pattern of compulsive use. So substance intoxication, unwanted physiological, biological effects, that psychological effects that cause maladaptive behavior. So there are so many changes because of the frequent use of the drugs. There will be unwanted physiological and psychological effects that cause maladaptive behavior. So there is a change in the behavior. It produces disturbances in the level of consciousness of the person and cognition and perception and behavior that are clinically significant. So physical dependence, what is physical dependence and what is psychological dependence? So if you come, is a state of adaptation and neurophysiological system which manifests itself by tolerance and intense physical disturbances when the drug is discontinued or suspended. So if there is a physical dependence on particular drug, so if you so the alteration in neurophysiology which manifests by tolerance and intense physiological disturbances and the drug is suddenly discontinued or suspended. Next, coming to the psychological dependence, a condition of feeling of psychological satisfaction and psychic drive. A drug produces requiring its continued intake to produce pleasure or avoid discomfort as manifested by its craving. The drug is discontinued. Psychological dependence means whenever it discontinues, there will be a continued intake to produce pleasure and avoid discomfort if you take after taking the you produce a pleasure and also discomfort. They avoid the discomfort as manifested by its craving. So if you won't take, there will not be there will be a discomfort on the person, and if he takes again, it produce a pleasure and discomfort. Avoid the discomfort when the drug is discontinued. Can occur in absence of physical dependence also. So addiction, what is addiction and what is drug habituation? A chronic disorder characterized by compulsive use of the drug resulting in physical, psychological and social harm and continued use despite evidence of the harm. So addiction means that, for example, it's alcohol or opium or anything, these are addiction drugs. If you take, there is a harm to the society and himself also. So characterized by compulsive user of the drug resulting in physical, psychological and social harm and continued use despite evidence he knows of that harm. So only habituation is a condition resulting from repeated use of the drug in which there is psychological and emotional dependence on the drug, though there is not much harm to the individual or society, like the habituation like coffee, cigarettes, like these, there will not be any much damage, harm to him or to the society. That is habituation, whereas addiction, it causes the harm to himself and to the society. So, differences between drug addiction and habituation. So, one is compulsion. So, in drug addiction, overpowering desire or need to take the drug, and by any means he tries to take. If he is addicted to drugs, overpowering desire and need to take the drug by any means. But in habituation, only desire to continue taking the drug, no compulsion. Here, no compulsion will be there, but desire will be there. But in a drug addiction, it is a compulsion. So, dose, tendency to increase the dose by repeated taking, and in habituation, no tendency will be there. So, dependence, there will be psychological and physical dependence in drug addicted persons, and in habituation, mild psychological dependence, no physical dependence, no physical problems. Next, withdrawal symptoms significantly present in addictive persons and in habituated person, they are none or mild. So harm, self and society, there will be harm due to the drug addicted persons, but in habituation to self only, if any, nothing will be there. But if any harm is there, it only to him. But in drug addiction is harm to the self and also to the society. So addiction is a brain disease characterized by a compulsive behavior. So compulsion to take the drug and continued abuse of drug despite negative consequences and persistent changes in the brain structure and function by taking it repeatedly. Pathophysiology. Dopamine, which is a brain chemical involved in many different functions, including movement, motivation, reward, and addiction. So nearly all drugs of abuse directly or indirectly increase dopamine in the pleasure and motivation pathways, and in so doing alter the normal communication between the neurons because of the disease of the dopamine, and they increase the dopamine in the pleasure and motivation of the pathways. But dopamine is a part of the story. Scientific research has shown that other neurotransmitter systems are also affected. Serotonin regulates mood, sleep, in etc. This also will be affected, and glutamate regulates learning and memory, etc. Also, these things also will be affected by repeated taking the drugs and in erective people. So, stages of evolution of addiction. Pharmacologically, addiction evolves in three stages. Early, first, it is the habituation or a period developed into addiction. So, if you take as a habituation, sometimes it may convert into the addiction. Intermediate, physical and psychological dependence are both will present, and there will be a compulsion of the taking of the drug. So by repeatedly taking, there will be a development of tolerance to many pharmacological effects of the drug. So also to its dosage and cross tolerance, and you will take more and drug. Why do people take drugs? To feel good. We have our feelings, sensations, experiences, share them, and to feel better, to lessen anxiety, worries, fears, depression, and hopelessness. So, what is coming to the epidemiology of the dependence? Prevalent in all religion and caste, common age group is 16 to 35 years of both sex, both literate and unemployed persons are equally involved. Main sources are peddlers, shopkeepers, and pawn shops. So you can get these drugs, shopkeepers and pawn shops and peddlers. Low socioeconomic group commonly used substances, as you know, cannabis, ganja, local liquor, and BDs. High social groups, heroin, foreign liquors, LSD, morphine, and some antidepressants. Scenario in India, Golden Triangle, that is Thailand, Burma, and Laos, Golden Crescent, Pakistan, Afghanistan, and Iran. They are sandwiched between two major drug producing regions. Golden Quadrangle, that is, so many are present at Varanasi, Lucknow, Barabanki, Badan of UP, and adjoining parts of Rajasthan. And so commonly abused drugs, alcohol, tobacco, frequently take marijuana, cannabis, painkillers, antidepressants, cocaine, hallucinogens, heroin, and methamphetamines. These are commonly used one, and designer drugs, it is a structural or functional lack of a controlled substance that has been designed to mimic the pharmacological effects of the original drug, while at the same time avoid being classified as illegal and avoid detection in standard drug tests. So symptoms in these persons. So CNS symptoms, there will be depression and mood changes and loss of interest and impaired memory and concentration, prefer loneliness than mingling with others, and depersonalization and emotional detachment and sleeplessness. These are the symptoms in the drug-dependent persons: depression, mood changes, loss of interest, and impaired memory and concentration, and prefer loneliness and depersonalization and emotional detachment and sleeplessness. So head and face symptoms coming to the redness and puffness of eyes and face, unclear vision, and there will be slurred speech. So general symptoms are lethargy, increased sweating, and tremors. These are all the symptoms, CNS symptoms, head and face symptoms, and general symptoms. Next, withdrawal syndrome. When you withdraw the drug, so that's in symptoms will be occurs in 3 stages. So early 6 to 8 hours of stoppage of the drug, scanning, rhinorrhea, sensation of chill or cold, and intermediate, that is after 24 to 48 hours of stoppage of the drug, rapid pulse and respiration, and good skin and tremors will present, and dilated pupils will present. So late after withdrawing, sleep lasting for 18 to 16 hours, and upon waking, all symptoms become more severe. So hazards of the addiction. So there will be always a desire to obtain drug by any means. Need money to buy. So by any means he wants to get the drug because of the addiction of the drug, which leads indulgence in theft and forgery and other criminal ways. Female may take up prostitution. Injection carries greater risk, non-drug related hazards, hepatitis B and HIV, etc. Females develop infertility, amenorrhea, and recurrent miscarriages. So newborns of drug addicts develop withdrawal symptoms like twitching, convulsions, and hyperactivity within 1 to 56 hours. These are all the hazards of the addictions. And body packer syndrome. What is body packer syndrome? This is illegal way of transporting illicit drugs like cocaine, heroin, cannabis from one place to another place. It is illegal and a crime. So how they will transfer to avoid the catching? So illegal way of transporting illicit drugs by human across international waters. That is body packer. How they will do? The accused is the courier. Drugs are packed into small cylinder-sized packets. They are packed into small packets and wrapped in multiple layers of latex, such as balloon, condom, or rubber gloves. And after that, usually they take constipating agent and then swallow the package. So they are present in the stomach. On arriving at destinations after traveling, they take a laxative and excrete out the drug package. A courier can take around 1 kg of drugs. Sometimes these packets sometimes cause bowel obstruction, interception, or may burst in the stomach and causing acute poisoning and death also. I have seen such cases also when I am in abroad. Body packer syndrome, these packets sometimes cause bowel obstruction, interception, or may burst, sometimes causing acute poisoning and death also. If the package bursts in the stomach accidentally sometimes and cause the poisoning and death also. So bodies have suffer. So hasty ingestion of drugs in order to evade law authorities during police raids, usually small amount of drugs for individual sale, risk of acute toxicity, that is body stuffer syndrome is there, and drugs are not wrapped for ingestion and transport purpose. If they indulge, there will be a poisoning. Approach to the treatment of the drug. One is detoxification, and after detoxification, you have to the counseling and the medication, evaluation and treatment of co-occurring mental illnesses, and long-term follow-up to prevent the relapse. So specific medications. for relapse prevention, that is opiates, methadone, buprenorphine, and naltrexone. Tobacco, nicotine replacement therapy by various forms like patch, gum, lozenges are available, and alcohol, naltrexone, disulfiram, acamprosate research still going on for development of medications for other type of addictions. So behavioral therapies modify their attitudes and behavior towards drug use. So by giving counseling, modify their attitudes and behavior towards the drug use. Increase the healthy life skills. Drug abuse death, epidemics. So generally illicit alcohol, which tragedy, sudden deaths from drug overdose due to the cardiac arrest, other causes like sepsis, bacterial endocarditis, and viral hepatitis, and sometimes AIDS. Diagnosis of death due to drugs. So you have to visit scene of crime. Victims are commonly found in unusual places where they have privacy to take the drugs or inject the drugs. Evidence of drugs can be found in the surroundings. So history obtained from friends and relatives and toxicological evidences sample to be preserved for chemical examination. Stomach contents liver, bile, kidneys, urine and blood samples. These are diagnostics of the death due to the drugs overdose. So examination of the body. So skin incision at the site of injection. If he takes the drug by injection, you have to give the skin incision at the site of injection. May reveal black debris, abscesses. So repeatedly he will take by injection. So we can see subcutaneous scarring, foreign body granulomas. So IV drug users, subcutaneous veins of antecubital fossa, forearms, and dorsal aspects of hand shows hyperpigmented linear needle track scars. Veins may be sclerosed and thrombosed. So direct addiction by inhalation, congestion and atrophy of nasal mucosa is common. Perforation of nasal septum also commonly seen if you examine these persons by inhalation or IV drug users. And internal examination, coming to the internal examination, severe congestion and edema of lungs, which manifests as white froth at nose and mouth, filling trachea and bronchi. So all these are postmortem findings, severe congestion and edema of lungs, which manifest as white froth at nose and mouth, filling trachea and bronchi. Hemorrhage spots, power endocardium in cardiac arrest, and hepatic lymphadenopathy is common. Urinary blood is frequently distended, and sometimes it is the only clue to death from drugs. So law enforcement. So there are narcotic drugs and psychotropic drugs. So small quantities which are not harmful, but commercial quantities should not transport all these drugs. Next, punishment. When they caught, the punishment will be when crime involve only small quantity, rigorous imprisonment up to 1 year or fine up to 10,000 or both. When crime involve quantity more than small quantity but less than commercial quantity, rigorous imprisonment for 10 years and fine of 1 lakh. So when crime involves only a small quantity carry, so the imprisonment is up to 1 year and the fine is up to 10,000 or both. And when crime involve from quantity more than small quantity but not severe, so rigorous imprisonment for 10 years and fine up to 1 lakh. When crime involve quantity more than commercial quantity, so the abnormal amounts, abnormal quantity, if you have rigorous imprisonment for 10 years, it may extend to 20 years and fine up to 1 lakh, it may extend to 2 lakhs. So volatile substance appear deliberately inhaling of volatile substances like example petrol, paints, kerosene, carbon tetrachloride, fabric cleaner, glue solvents. These substances have got psychotropic and hallucinogenic properties. Huffing, inhaling vapors from a cloth that is saturated with volatile substances, and bagging, inhaling and exhaling into a bag that has been filled with volatile substances. The symptoms of these persons, usually young male teenagers, resembles alcohol intoxication, perception distortion, mild hallucinations, and powerful dreams, detachment from reality. The cause of death is cardiac arrhythmia and cardiac arrest, hypoxia, and plastic bag asphyxia. Thank you.